So I'm going to discuss three cases, which I think I chose to kind of highlight the full gamut of breast cancer and breast disease that we can encounter. So case one is of a 57-year-old female with no chronic medical illnesses who had a mammogram detected lesion in the right breast on regular screening. She had no breast pain, no nipple discharge, no breast-related symptoms, and no constitutional symptoms, so no fevers, no chills, no weight loss. So we'll move on quickly to case two. So this case is a 39-year-old female, very young, no chronic medical illnesses, basically had a self-detected lesion in her right breast, meaning she felt a mass in her breast. She had no breast pain, no nipple discharge, and no constitutional symptoms. She has no significant past medical or surgical history and was not currently on any medications. Again, we're going to go through the breast cancer risk factors quickly. She basically had no significant risk factors. So case three, we're going to, again, showing the full gamut of breast cancer disease. So this is a 55-year-old female with a history of rheumatoid arthritis who was actually diagnosed with left inflammatory breast cancer in April 2022. She underwent neoadjuvant chemotherapy at that time, dose-dense AC, Taxol, pembrolizumab, but she had progression of the tumor on chemotherapy and immunotherapy. At that time, there was discussion of surgeries, but then even that was delayed due to prolonged oral mucositis, weakness, and pancytopenia. Unfortunately for her, insurance was exhausted just from the treatment of the chemotherapy. A lot was done to try and help her, but she got lost to follow-up. She went back to Jamaica. She was back and forth. And she kind of was just lost to follow-up and then represented to us now at a very late stage. This case just kind of highlights the variety of breast cancer disease and again, the importance of early detection, because you can see the complete difference with a case that was in the early stages of detected on screening. It's pretty straightforward. She comes in, she goes home the same day after surgery and recovers well and is back to her life as quickly as possible. And even in the case of when it's detected not from screening but by your own palpation, that highlights the need of patient awareness, the increased patient awareness for self-examinations. Because if you do feel a lump that you need to come in and get it checked out. It may just be benign, but then if it's benign and you find out, then you're rest assured. But if it's cancer and you find it early enough, it may not be as early as screening, but still early enough that you can be treated and cured. And also, that second case showed that it can happen in very young. Screening starts at 40, so what do? She was below 40, she didn't start screening yet. So the key is to get your breast cancer risk assessment done. All women should have that done at 25. Right? Because then that puts you in a different category. If by doing your risk cancer assessment, you find that you are high risk, then you may need to get genetic testing. You may need to start screening earlier. So that's all very important.